Making. Hi, everyone. It's Carol Lourie, naturopath, acupuncturist, homeopath, and your integrative breast cancer specialist. And I hope everybody's doing well in this very busy holiday time. I'm here today with Beth O'Hara, who is a functional naturopath and a mast cell activation and histamine specialist. And this is a not well enough known condition. And it's not often enough spoken about. And there is a connection between mast cell inflammatory disease and cancer, breast cancer. So Beth is here today to talk to everyone about her expertise in this topic and how it influences you ladies out there, and also most importantly, what you can do about it. So welcome, Beth. Thank you so much for being here.
Thank you, Carol. I'm so excited we can team up to help people like this. And I think this may be a game changer for some people to learn about this.
So why don't you just get started and tell people what mast cell activation syndrome is and histamine intolerance. I think there are a lot of women out there who've never even heard of this condition.
Yeah, there's a lot of practitioners who haven't even heard of it. And part of that's because mast cell activation syndrome just got a diagnosis code 3 years ago.
Wow.
Even though we know it's been around for a very long time. And here's why it may be a game changer for people. It's affecting, the research is showing us, anywhere between 9 and 14% of the population. So if we round down, we're at 1 in 10 people are struggling with this. And what I'm finding in my own practice is, as I'm talking to other practitioners, in people with chronic illness, it's around 50% or more.
Wow.
So very prevalent. And so the first thing people want to know is, okay, well, how can I know if I have this? And the symptoms people should be thinking about are, first, one, we have to remember that this can affect different systems. So it's going to show up very differently for different people.
Right.
One kind of presentation, and what's thought of as the classic, are things like flushing after high histamine foods like wine or beer, allergy kinds of symptoms, post-nasal drip, nasal congestion. This was allergy things, but also GI issues like constipation, diarrhea, bloating, discomfort after eating, sleep issues, breathing issues are really common. And then there are people who fall through the cracks, and they see a lot of different specialists. So these people are going to a gut specialist, they're going to somebody to help with their sleep, they're going to somebody for allergies, and no one's connecting the dots that these things are all related. But let me tell just about a couple of different presentations. So one.
Well, excuse me, just a second. And before we get into the presentations, let's talk about the metabolic driving factors of what's happening inside a woman's body with these syndromes. I think that's really important. And then we can go into presentations.
Sounds good. So when we talk about mast cell activation syndrome, we have to think about the mast cells in particular. And the mast cell, it's spelled M-A-S-T as in Tom. They're a type of immune cell. And I describe them as the frontline defenders of the immune system. It's like if the body is a castle, these mast cells are the guards at the front gates. And their job is to basically screen everything that's coming at the body, everything that's coming into the body. Is this a friend or is this an enemy? Is this a good nutrient? Is this a healthy food for me? Or is this a bacteria, a virus, a toxin? And your job, if there is a bacteria, a virus, some kind of toxin, is to create a lot of inflammation to surround that toxin or that bacteria or virus or fungus, mold, whatever we're thinking of, and then signal to the rest of the immune system and orchestrate that immune response to come clean us up and protect us. What's happening is that we're living in such a toxic world that we have toxicity coming at us nonstop, and the mast cells are getting confused and dysregulated. And so it's kind of like if you worked as a security guard, but you had to work 24/7 and you never got a break, you would start to get a little, loopy in terms of not being able to think straight. So if we think of the mast cells that way, the programming gets off.
And I would imagine that undergoing chemotherapy and having radiation really also impacts the mast cell system.
Absolutely. So we think about chemotherapy as it's a form of toxicity to hopefully kill off the cancer cells. But the chemo drugs and the chemo therapy IV medications do cause a lot of mast cell dysregulation, and so will radiation. And the mast cells, we didn't evolve with chemo and radiation, so we didn't have that 100,000 years ago. So the mast cells aren't sure what to do with that. And I do see a number of women after cancer treatments who have symptoms now that are residual they never had before those treatments. And then we start to think about mast cell activation syndrome. Did that get stirred up? And when the mast cells get so dysregulated, they start to fire at everything. And so instead of just firing at the invaders and then taking a break, I say they start firing at the butterflies, which can be healthy foods. And so people can develop a lot of food sensitivities. They start firing at fragrances. They start firing at, people can get chemical sensitivities, all kinds of things. Even stress can activate the mast cells to start to create this inflammation. And those mast cells can produce over 200 different inflammatory mediators.
Wow,
so
that's a lot.
It's a lot. They're very versatile, and they have all these different receptors on the outside, which is how they tell what they're supposed to respond to. And the most well-known mediator is histamine. So that's why we can get the allergy type symptoms. But there are people with mast cell activation syndrome that don't have allergy symptoms, or they don't have rashes or hives, so some of the classic things. So I have a client, and I won't use her real name, but I'll call her Anna.
Of course not.
So she has itching, she has some digestive issues and asthma. That's a more classic presentation. But then another client I'll call Jane, which how it shows up for her is she has mouth burning when she eats, but no other digestive symptoms. She has nerve pain, brain fog, and fatigue. And so she was actually misdiagnosed frequently, and mast cell activation syndrome was never mentioned to her because most practitioners think you have to have itching or hives or allergy symptoms, and it's actually not true.
Well, this is one of the beauties of naturopathic medicine or functional medicine, which is we all really want to get to the root cause and not just treat the symptoms, because as Beth said, her patients were going from one doctor to another, seeing different specialists for these different symptoms. But my approach and Beth's approach is we really want to get to the bottom line. What is driving all of these diseases or these symptoms? What do they have in common? And here we're talking about that. It's very important.
Exactly. And so I've identified, and I have mast cell activation syndrome myself. And that's how I got into this, because I was extremely ill. I was bedridden.
Wow.
I had with a cane. So I was one of the most ill people that I've ever worked with, because I worked with myself. And I saw over 50 practitioners, Carol, and I spent well over $150,000 trying.
Not hard.
It was awful.
And that is awful.
Long before the diagnosis code, but mast cell activation syndrome was in the research phases. And I was fortunate enough to stumble across it, and it just fit. I mean, it just, as soon as I read about it, this is what's going on. This is what I've been searching for 20 years. And so now that's what my practice specializes in. And I've identified 7 common root triggers.
Oh, great. Let's hear those.
So our 7 common root triggers are food triggers. And most people think high histamine foods like beer, wine, ground meats, salami, but there are other food triggers too, like lectins and oxalates.
Mm-hmm. Yes. And
then infections and toxicity. And I put those together because infections like Lyme, Epstein-Barr, mold toxicity, these all create toxins in our body also. Mm-hmm. And all of that, if we have chronic infections or chronic toxin exposures, and when we're talking toxins, we're even just talking about, fragranced candles or those plug-ins.
Oh, those are horrible, ladies. Nobody should have those in their home. They're so estrogen disruptive, and they're filled with chemicals. Absolutely.
They're immune disruptive, and they're carcinogenic, and everything is fragrance these days. And then there are genetic factors. So anything on the genetic, on that genetic area that contributes to inflammation, Where there's chronic inflammation, we're going to end up with some mast cell dysregulation. Then there's certain nutrient imbalances. So the mast cells are extremely dependent on sulfur. And many of the enzymes that are needed to manage histamine in the body are, for example, copper-based. So if copper and zinc are out of balance, if iron is out of balance, retinol, which is the active form of vitamin A, is huge. So I looked at a lot of nutrients in terms of how that can play out.
You know, copper and zinc are very important for keeping a woman healthy during and after breast cancer treatment. There is a imbalance that often happens between copper, zinc, and ceruloplasmin, and copper drives oncogenesis. So one of the things I'm always checking when I'm working in my clinical practice with women is, what is your zinc, copper, and ceruloplasmin levels, and are they out of balance? And oftentimes copper can be very elevated, and that is something that I think is not okay. And first of all, we want to increase the zinc, but then sometimes we need to chelate out the copper with a very special protocol that I refer to very specific medical doctors to help with. But I think that it's interesting that it's so important for driving breast cancer, and it's also a mast cell activation inducer. So it's important to acknowledge that.
Absolutely. And I think this is where we're seeing some of these links between mast cell activation syndrome and cancers. And there's a lot of research that just came out, even further linking mast cell activation syndrome and it being ongoing and not being managed and increased cancer risks. And that copper zinc piece also, we've got so much exposure to what's called non-bioavailable copper. So we do the copper IUDs, we're cooking in copper cookware, we've got copper pipes, and that's not the form of copper our bodies can use. And so that's why it's getting out of balance and elevated there.
Hopefully any woman who has breast cancer now or had breast cancer in the past does not have a copper IUD in her. And if you do, ladies, you should make an appointment to have it removed immediately. And also, using the birth control pill with breast cancer is not a very acceptable method of birth control either. And I'll talk about birth control at another. But I just wanted to mention that that's very alarming. Copper IUDs, anytime any woman comes into my practice with one, I always strongly recommend that she have it removed.
Right. And you're talking about the birth control. And so hormone imbalances are actually one of the other root triggers in mast cell activation syndrome. And this is because when we're estrogen dominant, which I know your listeners are very savvy, so they probably know we can have low estrogen, but if we have more estrogen than progesterone, we can still be in that estrogen dominant state. Well, estrogen activates mast cells, and then the mast cells produce more of their mediators, especially histamine.
Cytokines.
Yeah, and then histamine raises estrogen levels. And so we get this cycle going on of ever-increasing estrogen, ever-increasing mast cell activation. So that's one we have to take a look at. And then also oxygen issues. So I evaluate people's airway. A lot of people who are even skinny have airway obstruction. So we think of that sleep apnea being more of an issue of being overweight and too much weight around the neck. But I'm normal weight and I've had significant airway obstruction. And it has to do with whether we've got enough room in the mouth.
Right.
The teeth are wide enough. That's why I have the braces on. So I'm getting all this widened.
That's great. It's never too late to get your teeth fixed, ladies.
Right.
I always recommend people in my practice to go for orthodontia, no matter how old they are, because as Beth just said, we need a certain amount of space in our mouth.
Right.
It's not always just for aesthetics, but I think that is part of it, but it's also for your health.
Right. And I have these expanders. So that's one thing to look for is the orthodontist actually evaluating for expansion of the dental arch, not just straightening the teeth.
Right.
That's been huge for me. And my sleep is so much better now because my tongue's not falling back, blocking my throat.
That's great.
Like I was choking all of the time. And then stress and early trauma. So stress can be emotional stress, mental stress, even good stress. So if we get too much at a time, so I always do a stress evaluation and life events. So if somebody's got a new job, they just moved, and the holidays are coming on, those are all wonderful things, but it's excitement. And then I often see people end up with these mast cell flares in those kinds of events. So there's a lot on all of those that we don't have time to go into. But if people want to download the free report I have, they can check that out. And I've got that on my website at mastcell360.com/free report.
And I will be putting that link on this Facebook Live, ladies, also. So don't worry.
And so there's a ton of information in there. And then if you're curious about, well, I think I might have this mast cell activation syndrome, but I'm not sure, I've got a symptom survey. And that's at the top of my blog list. And so if you just go to mastcell360.com/blog, it'll be one of the top 2 posts right there at the top of the list. And you can take that survey and take a look and see.
So that's really wonderful information, Beth. Thank you so much for sharing that. Now, let's say a woman takes a survey or looks at your symptom checklist and it turns out she has too many of these numbers. And here she is, she's just finished breast cancer treatment. Now, I know my program is absolutely, the whole thing about it is to restore the health of the gut and to decrease the inflammation, which drives mast cell activation, but it's also so common post-breast cancer treatment. How can a woman, from your perspective, with your skill set, work with mast cell activation syndrome? What does she do?
So the first thing I do with everyone is, so I have an extensive intake, and I always apologize to people because I ask a lot, but one of the things I'm looking for are those food sensitivities. And so we customize the foods. I have everyone trial a low histamine diet. And there's a lot of low histamine foods lists online, and most of them aren't accurate. So I give them the foods list I have. I've got mine on that website. And I have people start there. And then we can kind of evaluate and see, well, does it look like lectins could be an issue for you, or oxalates? And then we'll customize that for them.
Let's talk about lectins for just a second. Tell people what food has lectins and what foods have oxalates, because I don't think everybody is aware of that.
Yeah, lectins have just been getting attention recently. And so we've talked about a lot in terms of in the healthcare space about nightshades, and nightshades being inflammatory. And those are foods like tomatoes, potatoes, eggplant,
red peppers,
red peppers. And that's a category of lectins. Lectins are a type of protein in foods, and they're highest in what we call the New World foods, the ones that were grown in the Americas. And so it also includes pumpkin, squashes, and those are our big lectin foods. A lot of grains. Lectins can be one of the reasons why people have trouble with wheat. So sometimes it's not actually gluten, it's the lectin part. Then people can get false negatives on those gluten sensitivity tests in terms of wheat sensitivity, because they're not checking for the lectin component. So lectins, why are we even talking about this? Why is it relevant to the mast cells? Well, lectins actually trigger a receptor on the outside of the mast cells to further degranulate. And so that's likely why people with arthritis feel better. With inflammatory arthritis, those that feel better getting rid of nightshades, or if people just get rid of nightshades, but they still have a lot of sunflower seeds, pumpkin seeds, a lot of other grains. Even quinoa is really high lectin.
Wow, I didn't know that. Yeah.
And so we'll try a low lectin diet also. That often clears it up. For me, I gave it a try because I still had joint burning symptoms, and I was still eating grains like corn and quinoa, even though
corn is yeah.
I know. But I replaced some of the gluten with corn. And
that's a common mistake when women do that. Plus, the protocol that I recommend is a very low grain. I mean, like, even if it's gluten-free, you don't want to be eating grain. It's mostly vegetables, proteins, and fats, and a little bit of fruit. So
exactly. And when I went off those grains and those lectins, the burning in my joints was gone in like 6 days. And then I did a trial 2 months later of reintroducing some. It was back like that.
No, well, 1 + 1 = 2, if that's really clear evidence, right?
Right. And then also what's so great about what you're having women do with going off the grains is many grains are really high in oxalates. And oxalates will also trigger mast cells.
And what are oxalates? Tell ladies what the oxalates are, because
Yeah.
you hear these terms, but not everyone realizes what they are.
Right. So oxalates are in plants. And if you look at them under a microscope, they actually look like tiny shards of glass, with microscopic razor blades.
Crystals, yeah.
Yeah. And they will, as they're being excreted, scrape the urethra on the way out. And that scraping stimulates the mast cells. And so urinary burning, interstitial cystitis is very connected. Right. They also lodge in the muscles, big contributor of fibromyalgia. No. And there are studies that show that they have lodged in the lungs and in the brain of people. And our highest oxalate foods are foods that we think of as being really healthy.
Spinach. People write to me, oh, I'm having a green smoothie, I'm putting spinach. And I go, oh, no.
I see so many people who did the green smoothie fad and they're doing spinach every day. And all of a sudden they're feeling worse and worse. Celery juice is a big fad right now. But if we're drinking 2 or 3 cups of celery juice a day, we're getting a lot of oxalate.
Nobody should be doing that. That's not healthy. One of the things that I want to say is in the Facebook group, there's been comments from women that they have chronic interstitial urinary tract burning. And here we have, I'm a homeopath, so I give women remedies for that. But I think nutritionally, which is always the foundation of how I approach any health condition, is here we have evidence that we need to change our diet, and why, which is really important.
Exactly. And I think it really drives home too that what's healthy for one person isn't healthy for another. So it's easy to get excited about these nutrition bandwagons and go, well, these people had all of this benefit from celery juice. Well, those people didn't have oxalate issues. And the people that have oxalate issues are the ones feeling worse on the green smoothies. Green smoothies aren't great if you have SIBO. So there's a lot of things we've got to customize it. And this is where I think we get the power of the work that we're doing, Carol, is individualizing everything.
Yes.
So those other high oxalate foods are beets, chard is very high, almonds are high, and not a lot of people eat rhubarb, but rhubarb is one of the highest oxalate foods.
And what about kale? Is kale okay to put in a smoothie? Because I recommend that, of course, it's organic. You take out the stem, you steam it, you take out the stem, and then you chop it. And you can put like a couple tablespoons in I call it a healing smoothie. How is that?
Flat leaf kale is what we want to be using. It's also called dinosaur kale. It's got that knobby looking.
Right. Lacinato kale. How's that?
Exactly. It's the same thing. Yep. But the curly kale is higher oxalate.
Yes. The purple kind. That's not. Yeah.
Yeah. So if we use that lacinato, dinosaur, all the different names for it, that's going to be much better. But we don't want to overdo anything. I'm seeing women doing kale smoothies and they're coming back with high levels of thallium because kale chelates the thallium, which is a heavy metal, out of the soil. I think variety is our key.
Yeah.
And just really checking these kinds of functional labs that we can check and make sure nothing's building too high on people.
Okay, so here we have your wonderful information, and a woman looks at your list and decides she's too high. What's her next step? She follows your nutritional plan, or she combines my nutritional plan with your nutritional plan? What does she do?
I think definitely try a lower histamine diet. Combine, if she's had breast cancer, then just cross-reference that lower histamine diet with your list. And see if that clears up symptoms. I like to rule out just if it's simply a histamine issue. If it's mostly a histamine issue, a large percentage of the time, the lower histamine diet is going to help. Now, if you're doing a lower histamine diet and your symptoms are maybe a little bit better or they're not getting better, then that's when we need to evaluate these root triggers. And so you're welcome to set up that case review. And I'll be happy to go through and evaluate what the root triggers are and really support the work that you're doing with Carol on the breast cancer side. And we dovetail these things together so people have a really targeted program for the mast cell piece of it.
Individualized protocols and healthcare is the beginning of your healing journey, and it's something that I always support. It's very important. So, Beth, thank you so much for this really valuable information. And this topic is so not spoken about enough. So I was very excited to share your knowledge with my community and just let people know how they can find you again. Sure.
So you can find the website at Mast, M-A-S-T as in Tom, Cell, C-E-L-L, 360.com. So it's all one word, mastcell360.com. If you have questions, just click that contact button and email us. And there are tons of free resources there in the blog. And if you download that free report, you'll get a lot of information also. And I just want to thank you, Carol. This has been wonderful. And this is my passion. I was sick for so long, and it took so long for me to get answers. So the more that you can get out there and team up with other wonderful practitioners like you and help people, the better.
That's what we're both here for, to serve women in their health journey and help them optimize and achieve the best health that they deserve. And thank you so much, Beth. Ladies, I will be back on later this week with more Facebook Lives. And actually tomorrow I have another guest. And I hope everybody is having a lovely afternoon, and please post your questions. And I will post Beth's link on top of this Facebook Live post. Thank you so much for joining us, Beth. And ladies, there'll be more later. Have a lovely afternoon.
Thanks, Carol.